You or someone in your family or a close relative or a friend has been advised an open heart surgery and you are not sure how the post-operative recovery period is going to be, when the person will be able to resume duty, when the normal activities can be resumed. You don't know where to ask, so don't worry. That is our topic of discussion in Traffic Ki Pathshala today. I am your heart specialist, Dr. Vikas Keshri, discussing post-operative recovery after open heart surgery in Traffic Ki Pathshala. In my previous video, I have already explained that all the open heart surgeries are elective procedures and mostly you are explained all the things to be expected after the operation by the surgeon in the preoperative period itself. You can refer to that video. Today I will start from the day of surgery. What happens on the day of surgery? On the day of surgery, when you are shifted to the operation theatre, you need not be worried. One small cannula is inserted in your hand and anesthetic medications are given through this IV cannula. Once the anesthetic medications are given, you go into a deep sleep, and when you get up from this sleep, operation is over already 2 to 3 hours before you get up. So during the procedure, whatever surgeons are doing, whatever procedures are being done, you are totally unaware of the circumstances because you are under general anesthesia. After the operation, you are shifted to the ICU also under general anesthesia and attached to a ventilator. In general, our practice, our day-to-day practice, we take the patient out of ventilator in 2 to 3 hours. That is the time when we observe whether the heart function is proper, blood pressure is okay or not, the bleeding is there or not, heart functioning is good or not, ECG rhythm and other things are working properly or not. Then once all these things are ensured, we take you out of anesthesia and you are conscious. This is the time when your relatives can come and see you and talk to you. In general, on the same day after the operation, by evening, some liquids are given to you and next 2 days are spent in the ICU. On the first day after the operation, you will be allowed to move around in the bed, to do some exercises and breathing exercises, made to sit on the bed, and most of the tubes and lines which are there for monitoring purpose are removed on day 1. Day 2 in the ICU, you will move around, you will be made to walk, and with assistance of the sisters and physiotherapy people will teach you some exercises to do. In general, by the evening of the second day or third day morning, you are shifted to the ward. By the time you are shifted to the ward, most of the intravenous medications have been stopped and you are generally on oral medications, and you are taught and your relatives are trained to take care of you at home. So you have to move around in the ward, do the breathing exercises, and some tests are done. By the time you are discharged from the hospital, all the lines are stopped, all the oral medications are going on, IV intravenous medications are stopped. In the hospital itself, you are taught to move around in the house, you are taught to climb 1 or 2 flights of stairs, you start taking bath daily in the hospital, and you are on full oral diet before you go home. So by the time you are going home, you have resumed most of your day-to-day activities. Now comes the time of discharge. As I told you in my previous video, that there should be one adult person, responsible adult person, to take care of you at home. This person has to understand all the instructions along with you so that there are no mistakes. So most important thing after the open heart surgery are medications. So you must understand what are the medications to be taken, what is the time the medication has to be taken, whether it has to be taken empty stomach or after the food or before the food, and in what doses. These things have to be made sure that there are no mistakes in this. Very important is that many people do self-medication after operation. This is not a right thing. There are many people, untrained people, who will tell you, take this medication, your recovery will pass faster, take this medication, your wound will heal faster, take this medication, your side effects will be less. Please don't fall into the trap of unprescribed or proprietary medications. Take only those medications which have been advised by the surgeon to you. Don't do self-medication. Another very common mistake many people do after an open heart surgery, or other patients also, that when they start taking the medications, they feel there are some complications or some side effects happening due to this medication, and then they stop that medicine. Please don't do that. Do not stop any medication because of some suspected complication or side effect. If you think that some medicine is causing some problem, please bring to the notice of your physician or your surgeon so that they can take alternative measures or give you some other medications. So these are the precautions related to medicines. For people who are diabetic, they have to continue taking their medication and they have to do some regular monitoring of their blood pressure and sugar. Now comes diet. That is also a very common question people ask about what is the diet to be taken after open heart surgery. So I have made a separate video regarding the diet after valve operation and bypass operation. In this video, I will tell you in short what are the things to be taken. So most important thing is you have to eat healthy food which is cooked at home. Please avoid food which is cooked outside or which is left in open for a long time, or food which is half cooked or improperly cooked. You have to take healthy food which is made at house. In general, if you are not diabetic, we do not advise lot of restriction in the first month because your energy requirement and healing requirement is more immediately after the operation. You are advised to take food which is rich in protein, and you are advised to take which is rich in fiber because you should not have constipation. So with the fruits which are cooked at home should be rich in protein, and it should be rich in fibers also. Milk, egg and meat you can take in regular quantities which you used to take before operation. You can take chicken, you can take fish in regular quantities. In case you want to avoid, you should avoid mutton after the operation because it causes some problems. So that becomes about diet. Then people ask whether they can take some juice or not. So you can take all the seasonal fruits and vegetables unless you are diabetic. All the seasonal fruits and vegetables are allowed. All the cashew and resins are allowed to be taken, but juices, for the fear of infection, we advise you not to take juices which are made in the market in open and kept in open. Even if at home you are preparing the juice, please consume the juice as soon as it has been prepared. Don't store it and consume it later because it may lead to some infection. If you can avoid juices, it is good. Packaged juices you can take because they are safe from the infection point of view, that you can take in limited quantity. Whatever I have told you about food precautions is for those people who do not have diabetes. If you are a diabetic, all the restrictions which you are following before the operation will remain to be same because precaution for diabetes is the same even before an open heart surgery and after an open heart surgery. What are the food and what are the things you can take or not take for diabetes? I have made a separate video for that. You can refer them, but those restrictions remain same after an open heart surgery also. Another point worth mentioning about diet is for those people who have undergone a valve operation, people who have been operated on valve has been repaired or replaced, they are given a medication, blood thinning medication called warfarin or acetrom. These people should not take food which is rich in vitamin K in large quantities. They are not restricted, but they should be taken in moderate amount. These foods are green leafy vegetables, cabbage and cauliflowers. I have made a separate detailed video regarding the food after valve operation and bypass operation. You can refer to that for more details. But in short, you should not take food which is rich in vitamin K if you have undergone a valve operation. Some people have some restriction regarding the liquid intake after the operation. This will depend upon the kind of operation you have gone and the heart function you have. People generally who have poor heart function are advised some fluid restriction. One very important point in this fluid restriction is that whatever amount has been prescribed, suppose the doctor has said you can take 1.5 liter of fluid in one day, that includes quantity of all the liquid substances. It's not just water. If you are taking milk, if you are taking, by the way, milk you can take in regular quantities. If you are taking milk, if you are taking juice, that should be counted as liquid and the amount has to be kept to that restricted amount. So that becomes the diet. Now next question comes how to take care of your wound. So in general, no special care of the wound is required after the operation. One common mistake people do that they do not take bath after the operation for the fear of wound getting infection. They say if we put water, the wound will get infected. That is totally wrong. We advise all people to take bath with plenty of soap and plenty of water and soap, and you are supposed to apply the soap on the wound and keep it clean so that there is no infection and there is no ointment or any oil application required. You can leave the wound just open to the air so that it is dry. Then one common question people ask, Doctor, when I can start taking alcohol? So our advice is that alcohol should not be taken after open heart surgery, or even otherwise for healthy people. The alcohol is not a beneficial thing. This is a common misconception that alcohol in small quantities help the heart or heart diseases. There are no conclusive proofs and the evidence which is there for this is very weak. So you should avoid alcohol by and large. But if you are forced to take alcohol due to your activity, probably after 2 weeks after open heart surgery, you can start taking around 2 packs of 30 ml twice a week. That is the maximum amount we can tell you is advisable. Beer contains a lot of quantity of glycerin, so we generally advise people not to take beer after the open heart surgery. We advise you to omit that. Comes to tobacco should not be taken in any form. There are no medicinal or any otherwise benefits of tobacco. So after open heart surgery, tobacco is prohibited, smoking is prohibited. You must not smoke, must not take tobacco in any form, either smoked form or eaten solid forms. Next very common question is about the physical activities. What are the physical activities and when are those physical activities that we can start? So physical activities, as I told you, while you are in hospital, by the time you are discharged, you have started moving around in the house, you have started getting out of the bed, going to toilet, you have started taking bath daily. These things you have to continue at home. One very common question people ask that, Doctor, our house is on first floor, can we climb the first floor, second floor? Yes, you are allowed to climb 1 or 2 floors as your body allows in small increments. You are advised to get down from your if your house is on first or second floor, you are advised to get down and walk around morning and evening at least 20-30 minutes daily, because that makes the recovery faster. There are 2 restrictions only when physical exertion comes after operation. One is not lifting weights. You should not lift weight. So if there is a grandchild in the house, that child also is around 5-6 kg. So lifting the child and playing is an exercise for you. You should avoid that. And suppose bucket filled of water, you should not try to lift it. That is also around 10 kg, and you should avoid that. Second restriction is about bed rest. Most of the people think that open heart surgery is a big operation, we should take bed rest after open heart surgery. That is not the case. People who take bed rest, they have problem in recovery and they recover very slow. The wound healing, the pain, the cough and other things which happen after open heart surgery are more, and they may have fluid in the chest, that is pleural effusion. So you are advised to not take bed rest. You will be advised some physiotherapy and breathing exercises after open heart surgery that you have to continue to do, and you must take some steam inhalation which will be advised along with the prescription after the open heart surgery. Now comes activities which require little more of exertion, like going to jogging, cycling, doing some exercises and going to gym. These activities you can start after around 12 to 14 weeks after open heart surgery. That means around 3 months after the open heart surgery. Commonly people ask, Dr. Saab, can we ride a car or bike, or can we drive a car or bike? So riding a bike as a pillion rider is totally okay. You can ride in a bike as a pillion rider, or you can move around in the car. But driving, we ask you to stop at least for 3 months, because sometimes people have giddiness and that may lead to accident. So driving is not allowed for 3 months, but once 3 months is over, you can start your driving. A very common question is, when can we resume the sexual activities? So sexual activities require a lot of energy. So ideal time to resume sexual activities is around 12 to 14 weeks, or roughly around 3 months after the open heart surgery. You can come back to regular sexual activities. Many people ask very commonly that how long they are supposed to wear the chest binder and the stockings or the crepe bandage in the leg. So chest binder is given so that when you cough or you do some breathing exercises, you don't have much pain. It supports the chest bone in healing. And stockings are given in the legs so that there is no swelling in the leg. So these things are supposed to be kept to be used at least 4 to 6 weeks after the operation. These things are not to be worn 24 hours a day. Actually, when you are sleeping, you can remove this. When you get up in the morning, you are supposed to take a proper bath and wear the stockings. Make sure it is as tight as possible, and then wear the chest binder whenever you are sitting or moving around. When you are lying on the bed, you can not wear the chest binder because it will cause unnecessary discomfort. So in short, it is supposed to be used for 4 to 6 weeks duration. Another question people ask very commonly, that how long they are supposed to avoid sleeping on one side. So Dr. Saab, karvat kab tak nahi le sakte? So the chest bone takes around 4 to 6 weeks to heal. So this is the 4 to 6 week period during which you are ideally not supposed to sleep on one side. But if you are not very comfortable, you can put one pillow on the side and take the support of that pillow to lie on one side. One very common question, people who are in job or who are working, they ask how much leave is required. So in general, after open heart surgery, you need only 1 month of leave. That is the time the bone takes to heal, and during that time you need some rest. So if someone is a doctor or a lawyer or a judge or a teacher or a shopkeeper or a businessman, he can take 1 month of leave. More than that is generally not required. Very rarely more leave is required. In that case, your physician or your surgeon will tell you to take more leave. One very important point to mention is about visitors. So we are a human being is a social animal. We have a lot of friends and relatives. They are worried, and a lot of people come to visit us after the open heart surgery. After an open heart surgery, your resistance to infection, your capacity to fight with infection is little less. Your immunity is less. So chances of catching an infection are high. So that's why you must avoid a lot of visitors in your house. Try to keep the number of visitors limited, and advise them to follow all the cleanliness and procedures when they come to meet you. What are the things which should alarm you, which should make you to visit a doctor? So I have made another video regarding what are the things to be done and what are the things which are normally expected. But in short, you may have some little bit of breathlessness. You might have mild chest pain. You might have mild giddiness while walking. You might have little weakness, feeling of weakness. The taste of mouth is changes, so you may not have proper hunger, and you may not have proper sleep. These things are normal. Small little bit of wound discharge from the wound, and small swelling from the leg. These are the normal things which are, and little bit of cough. This is normal after an open heart surgery. It happens in most of the people, so these should not be make you worried. But in case you have a lot of pain in the chest, you get severely breathless after walking, even small amounts. There is a lot of discharge coming from your wound, or you can see that some pus is coming from your wound. There is redness. If you are able to hear some tuck 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 sound from your bones, then these are warning signs. If you have lot of swellings in your leg, and if you are not able to sleep at all, these are the warning signs. Then you must come and contact your surgeon for a review. Very important for those people who have undergone a valve operation. Many of them complain that there is some tick 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 sound coming from the chest, like watch. So that sound is coming from the metallic valve which has been implanted. That is absolutely normal. You should not be worried about it. With time, that sound, the intensity of that sound will become less, and you will get used to this also. So for that, you need not worry. That is totally normal. Last point is in today's discussion: follow-up after discharge. In general, after discharge from your hospital, you are asked to come 1 week later or 10 days later for the first follow-up. On this date, your sutures are examined, you are examined, some blood tests are done, X-ray, ECG, and if required, echocardiogram is done, and then your doctor tells you to go back home with a smaller number of medications. So all our patients who come from UP, Bihar, or different other parts of country to Delhi or Gurgaon to get operation done, they can go back home by train or by flight or by car or by taxi or by buses or any other means of transport, whichever way they want. And then generally they are called back for first follow-up at 1 month. At this time, again some blood tests, X-ray, and if required echo and ECG is done. And then you are allowed to go and resume your duty. You can resume your duty normally. And then this, depending on the underlying condition of your heart, you are advised to continue follow-up with your surgeon at a regular interval. As the time passes, this interval becomes less and less. For example, initially you might be asked to see the doctor every 3 or 6 months, and later this period may become 6 months or 1 year. It is very important that you continue these follow-ups, because some important tests are done on these follow-ups, and many times many medications are stopped and you remain on very small number of medications. One common mistake people do, that if they have been asked to come after 3 months and they are not able to come, they stop the medication at 3 months and then come to the doctor at 6 months. The doctor, I had stopped the medicine 3 months ago, now I have come for follow-up at 6 months. Please don't do that. If you are not able to come for follow-up, continue to take the medications. Stop those medications only after your doctor has examined you and told you to stop those medications. So I hope I have answered all your questions and queries regarding recovery from an open heart surgery. If still there are some doubts, please ask to me in the comment section. I will try to answer those queries and questions. Till the next episode of Traffic Ki Pathshala, seeking your permission, your heart specialist, your heart surgeon, Dr. Vikas Kumar Keshri. Stay connected, stay healthy. Thank you.